How to read MRI scan of herniated lumbar disc. Welcome to my channel Zen Spine. My name is Dr. Rakesh Thake. I'm a consultant spine surgeon working in Mumbai, and I also practice in Nasik on the weekends. Coming back to the topic how to read MRI scan in herniated lumbar disc, we should first understand what a normal lumbar MRI scan looks like. Now, as you can see on the screen, the normal lumbar spine MRI scan is composed of 5 vertebrae from this region to this region, which is L1, L2, L3, L4 and L5. Now, this is the lumbar MRI scan of a patient who is facing this side. The front of the patient is this side and this is the back of the patient, and that patient has been cut longitudinally so that we are seeing the bottom of this spine cut in longitudinal section. Now, if we look at the bottom of the spine, which is this region, the lumbar region, it is composed of 5 bony blocks, which are L1, L2, L3, L4 and L5. Now, between these bony blocks are the intervertebral discs, which are pointed by these arrows. These discs are the cushioning material which separate the bony blocks to keep you mobile. Now, behind these vertebral bodies and the intervertebral discs is the spinal canal, in which you can see this white fluid. Inside the white fluid is floating the spinal cord, which is this black structure which finishes at the level of L1, and then these are just the nerve roots floating in the spinal canal. Now, a normal lumbar MRI scan will have this intervertebral disc contained in their margin in the front and the back, and the nerves are floating freely in the spinal canal. Now, let's look at an abnormal MRI scan so that we can understand what a disc herniation looks like. Now, this is an MRI scan of a person who has disc herniation at the bottom 2 levels, as you can see in this picture. Now that you have already understood what a normal MRI scan looks like, you can yourself make out that till here there is a nice white free flowing fluid in the spinal canal, and the nerves are also free. But as you can see here, the discs are bulging at the bottom L4, L5 level, L5, S1 level. These are the 2 discs which are bulging and protruding into the spinal canal, occluding the white fluid and pressing on these nerves. To look it into more detail, they take axial section or slices at these 2 levels, and that slice looks something like this. Now, this is an axial picture where you are looking at the vertebral body, and behind the vertebral body is the thecal sac, or where the cerebrospinal fluid or the white fluid is enclosed. In this white fluid are the black dots, which are the nerves floating inside the fluid. So this is a good picture. This is a good picture. This is a good picture. As you can see, there is nice white fluid and black dots floating in the fluid. This is good. This is good. But when you come to L4, L5 and L5S1 level, you can see here that the disc fragment which is herniated is almost protruding this much into the canal and occluding the space of the canal and pressing on the nerves. Same is the situation here at L5S1 level, where the disc is almost occluding this much space in the canal. So this is how the MRI of lumbar disc herniation looks like. Having understood what a normal MRI scan looks like and what an abnormal MRI scan looks like in the condition of lumbar disc herniation, you should now be able to understand and read the MRI scan for yourself. However, I request you that you please do not make this decision for yourself and not read the MRI scan for yourself. You should always visit an expert to make that decision and guide further treatment. Thank you.